it's important to go for you to do your own self-examination. A lot of these lumps can be detected on very basic, simple self-exam, and then you can get your mammogram. First of all, how many different type of mammograms do we have, Dr. Lee? I know about regular mammograms. Is there a difference between 3D versus regular mammogram in detection rate, and who is the candidate for that?
Okay, so that's a great question. So even a step back from, let me just give you a little bit more background. The ACS, American Cancer Society, and the U.S. Preventive Service Task Force, all their data really is still based on film screen mammography. And it's digital mammography that's already an innovation on film screen that has really become standard of care now. And so realize that if anything, mortality reduction with routine annual screening mammography starting at 40 is even better than what some of the older data is going to show. Now, your question has to do with what's become or becoming more standard of care, or hopefully standard of care, and you're referring to 3D mammography, what's used in lay language, but what we also call digital breast tomosynthesis. And this is exciting because what this means is that dense breast tissue on mammography, which is just as a reflection of how much fibroglandular tissue there is, creating a whiteness on the mammogram, which is a low-dose X-ray. How much whiteness there is on the mammogram just normally can make it more challenging to see a small non-calcifying breast cancer if it's present. It can also actually create mimicry, meaning having dense tissue, having areas that are eye-catching, can actually be a fake-out that we're also having to figure out as we go about.
That's on a regular mammography.
That is on digital mammography, yes. Now 3D, the digital breast tomosynthesis, is something that we're all excited about, because what that allows us to do is go thin section by thin section through the mammogram, hopefully revealing a small non-calcified cancer that might be present, but realize that we're picking up more, quote, false positives along the way, meaning things that turn out not to be benign, or maybe they're high-risk lesions but not cancer. All these things that we have to manage as we see it.
So you think that the 3D is going to replace the old-fashioned mammography?
You know, these are, you mean digital mammography? Because
Yes.
remember, that's not the old-fashioned
Yes.
mammography.
Digital.
You know, it's an interesting question that we're still having to work out, because how tomosynthesis is actually implemented from one practice to another, from one region to another, from one remote facility, you know, who's looking at low resources, to something that's state-of-the-art, et cetera, et cetera. It's going to be heterogeneous, but there are many who really do hope that tomosynthesis does become the standard.